The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare. Of course, we'll go through the standard ABCs so you know what all Medicare is, but also if possibly you continued working past 65 and you're covered by your employer's insurance, and you're going to be quitting your job, we'll be talking about how you can sign up for Medicare. Plus so much more, so stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Receiving help for Ella has been life-changing, and the best word for it is relief. I was the therapist, I was the aide, and I couldn't be the mom because emotionally you're just to your wits' end. You're trying to survive.
I provide care for the Harrises, specifically their daughter Ella. Respite care is extremely challenging, but the rewards that you receive from it are 100 times more than working with a child that doesn't have special needs. Once they get something, it's everything. It's a you celebrate. You don't just enjoy those moments. You celebrate every moment that you get, that you guided them to that next step.
Respite. It's okay to need it. It's okay to want it. Will you provide it? Call 800-224-6034 or visit respite.mt.gov.
It went from survival to enjoying life and being able to be a mom again.
Brought to you by the Montana Broadcasters and this station.
Hi folks, and welcome to Aging Horizons. Brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore. As I mentioned, we'll be talking about Medicare, the Part A, B, C, and D, what they are, and we'll be talking about so much more. Joining us, of course, is Kimmy Everman. You're the Department of Public Health and Human Services social media and outreach person. Welcome to your show.
Thank you. It's always good to be with you, Brian.
Well, thank you. And let's start at the top. You know, we've mentioned a lot of people, they hear the word Medicare, but they're not sure what Part A, B, C, and D are.
Right.
What are they?
Well, I want to say, and we're going to run the number on the screen.
Yeah.
You don't have to do this alone.
Right.
There are SHIP counselors that are there to help you get through the sort of muck and mire of it all.
Right.
So you don't have to do it by yourself. That's the first thing.
Yes.
Secondly, let's talk about the ABCs because Medicare is A, B, C, and D, right? So you have Medicare Part A, which is your hospitalization, and that might be referred to as your major medical, that type of thing, and it's for hospitalization. So if you're having some major health concern or you've been in a car accident or something like that, that's what's going to cover your expenses, is that Part A. And then Part B is your outpatient. So if you're going to the doctor because you've got a headache and it won't go away, those are the sorts of outpatient things that Medicare is going to cover under Part B. And then we're going to skip over C for a second, and we'll just go straight to D. Part D then is the prescription drug coverage for Medicare. So you can buy a whole standalone plan that covers your medication under Medicare. Very robust program. Great that we have it. We're really happy that we have drug coverage now. And then let's go back to C. C is a combination of everything that we just talked about. So under C, which is also referred to as Medicare Advantage, you get your Part A services, so your hospitalization services. You get your Part B, so your outpatient services, and you get Part D usually, which is your prescription drug coverage, and that comes in one big package that's called the Medicare Advantage plan. You know, that's a situation that some people like the traditional model of Medicare, which is just the A, the B, and the D, and oftentimes they'll also purchase what's called a supplemental insurance. And under that traditional model, that covers your 20%. I think we need to remember that Medicare is an 80-20 split. So 80% is paid by Medicare, and then the patient or the beneficiary is responsible for the remaining 20%. And so if folks want to have a little bit more security about what they're paying when they have medical, they might buy one of these supplements, which picks up that little 20%, which I shouldn't call it little, it can be big. So, and then what the supplemental is just, it's a secondary. It just comes in to help pick up those extra costs so that you don't have to do that out of pocket. And then with a supplementary, you are paying each month anywhere from $50 on up. I mean, it can be depending on what you want.
And what you chose.
Yes, and what you choose in your plan. It might, you know, be any number of different costs. And that's the sort of thing that when you're looking into Medicare, you definitely want to look at, do I want traditional or do I want to go with the Medicare Advantage?
Okay, so Medicare traditional would be Part A, B, and D if you choose. Medicare Part C is an Advantage program which is provided by private carriers, and you would choose that if you want it. And now is the supplemental a part of the C, or is that still another
well,
add-on?
you know, in a way it is, Brian. That's a good question, because the C helps pick up extra costs, just like a supplemental
and maybe
would
more
do.
benefits too.
Exactly,
right?
and you might have more benefits. Also, excellent remark, because you might have things that Medicare doesn't normally cover, like maybe there's some vision. Maybe there's some hearing, maybe there's some dental. Things that are not normally covered by Medicare might be an extra benefit under that Part C or that Advantage plan.
That's right. Okay. Well, so now, you know, we opened up and we mentioned about that individuals that are working past 65, if they're covered by their employer, they don't have to be a part of Medicare. But there's some details there, and you're the detail person. Tell us more.
Exactly. And because many people are working past 65 these days, and they are covered by insurance that their employer offers them. And you don't want to have to pay for two if you don't need to.
When only one will pay.
Exactly. That's true, because you can pay for two, but only one will pay towards your insurance costs or your medical costs. So it's very important that you are making sure that you talk to your human resources when you turn about 64 or so at work. Decide what it is you're going to do forward, and then make that decision. Do I need to get onto Medicare yet, or am I going to wait for a while, stay at my job, keep my employer insurance, and then go from there? And you get creditable coverage that way.
And you mentioned talk to HR. Talk to your ship counselor too.
Indeed.
And we got their number on the screen and website if they have one. And they're the individuals that know best what you can do. I mean, talk to your HR. Of course, you got to coordinate between the two. But if you're a little uncertain about Medicare at all, if you have questions down the road, you're already covered, you're thinking of being covered. If your parents have questions and they want you to help figure it out, talk to a ship counselor. We'll be right back.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
Every generation produces heroes, men and women who step forward to defend our country in time of need, no matter the personal cost to themselves. And though we can never fully repay them, we can make sure they have access to low-cost, long-term care when they need it. That's what Montana's Veterans Homes are all about. If you've got a hero in need in your family, call us. We can help.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. In this segment, we're going to continue discussing about Medicare, and we're going to kind of focus on your initial enrollment, what you want to think about ahead of time, maybe if you're helping your parents, what they want to think about ahead of time when they become eligible, and what if they're still working. Rejoining us, Kimmy Everman. You're the social media and outreach person for Department of Public Health Human Services Senior Long-Term Care Division. And what about enrollment? What do we want to start thinking about when we're at what age, and what does the complications of our becoming eligible for Medicare do for us?
Yeah, well, and Brian, it's, everybody is different in their planning strategies, but I would suggest at 63 and a half, 64, in there, you're thinking about, when am I retiring? Do I want to continue to be employed after 65? And let's just stop for 1 minute and say that, and remind folks that Medicare is not based on needs. Medicare is based on your age and your work credits. And so Medicare comes at age 65 as long as you have the 40 working credits that you needed for your entire working career.
And those are 40 quarters, right?
Quarters, yes, exactly.
That you've worked. Quarters are a quarter of a year.
Right. And so you want to make sure that you're looking at, what do I want in a couple of years from now? Because it can take that long just to plan what it is you want to do.
Yes.
So one of the things about Medicare and retirement is that if you have coverage through your employer, for the most part, that's creditable, and that's all that means is it's as good as or better than Medicare. And so it's real important to talk to your human resources person as well as your SHIP person, and make sure you're in the right zone even for being ready to look at retirement. And then you're going to say, okay, again, do I want to continue working after 65? Many folks do. If so, you get to not sign up for Medicare without a penalty.
Right.
Okay. If you wait to sign up for Medicare without sort of being covered by creditable employer insurance, and without checking into that first, you may end up with a penalty. You need to sign up when, in the right enrollment time. So again, that's why you're talking to the SHIP counselor and your HR person, because you don't want to get that penalty. That's a penalty that once you get it kind of stays with you, forever. And it might even affect when you can actually be covered. And there's many things that
it's a big hassle.
It is a big hassle, and so you want to avoid it if you can. One of the great things about SHIP counselors is that they can help you plan for the future, and you don't have to sign anything or decide in that moment that you're going to do something.
Right.
Just go talk to that person and find out what do they know about the Medicare and the retirement and the working and the not working.
But now I think it's important that I decide that I'm working and that my employer's insurance is better than Medicare, or I want to stay with it.
Right.
I need to tell Medicare that.
You do.
I mean, otherwise
you do
go for penalties.
And for the most part, now as a person who works for the state, what we get every year is a letter that says our insurance is as good as or better than Medicare, or I do anyway, because I have a family member who's on Medicare, who's younger than 65, and so that is your proof that you, and for the most part, Brian, everything's creditable. I mean, it would be very unusual if it wasn't, but that's a question you must ask to avoid any kind of penalty.
Any kind of penalty. Well, now you say when people are planning, now an individual can take Social Security early at 62, which is prior to Medicare. But when you turn 65, the generalized, they take the Medicare premiums out of your Social Security, but they won't be doing that at 62. So that will be a change in your future financial status.
Exactly. And retiring at 62 is certainly possible. And for many folks, it's preferable, what they want to do. But we need to remember that Medicare, if you're not covered with some other health insurance, Medicare won't come till 65 unless you have a disability, and a disability determined by the Social Security Administration. So, and that again it can be a big hassle. So don't go into it with your eyes closed. Always be asking these questions. And you know what? The SHIP counselors can help you figure out which questions to ask.
And you don't have to be 65.
No, you don't.
You can be asking for your parents, and even if you get bills that are funny, they're hard to understand. They'll help you. They'll help your kids. They'll help you, your representatives. They're a wealth of information.
And that's what they're there for. And they're, you know what, frankly, they love helping folks with this and want to make sure that, because what our SHIP counselors would rather is that they catch it before it's a problem and be proactive instead of reactive.
And what's important too is that the SHIP counselors work for the state of Montana. They don't sell a product to you. They don't have something on the shelf. They're an advocate for you, but you have to choose. There's a variety of options out there, and they'll help you to understand what those options are and how they best meet your needs. And as we talk about health issues, they change from year to year, so you don't have to decide once for the rest of your life. It's a changing target with your health, with your needs, with your medications, and they're local. I mean, we have them all over the state. We have them in your town. You might know them, but an important thing to consider too is that everything is strictly confidential. Nothing goes out of the office about what you reveal to them or what you talk to them about. But give them a call. They got a lot of great information. Now we'll be back with some helping programs that are available if you're eligible, so stay tuned.
I was diagnosed with diabetes in 1992 and I went into denial. It made me angry. I was a professional chef and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
If the Aging Network in Montana was a restaurant, the sign out front would say, over 50 million meals served over the last 30 years. Since adequate nutrition is critical to health and quality of life, nutrition services are an important factor in keeping older Montanans healthy, independent, and living in their community and home. To find out more about senior nutrition programs in your area, call 1-800-551-3191.
Is that Robert Knievel? Captain Lewis, Captain Clark, I'm officially Evel Knievel now. I'm getting my Montana Real ID.
Did you make an appointment at mtrealid.gov?
Yes, sir.
Smile.
I brought my non-laminated Social Security card, 2 documents proving my current residential address, and my certified birth certificate.
Approved.
Go to mtrealid.gov.
Now I can fly. It's that easy.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare, Medicare and You, and actually that's what they call the book that comes out. It'll be coming out in September. Explains all about Medicare. You might have it sitting on your coffee table right now for the 2022 if you've been Medicare eligible for this year. So, Kimmy, an important part of Medicare and You is each year you have yearly benefits in which you can go to your physician and they will make sure you're tracking well.
Right.
What are some of those?
Well, and I'm going to call them preventative benefits because that's really what they are.
Mm-hmm.
You do it on a regular basis and it helps prevent worse health crisis down the line. And things that Medicare covers preventatively are things like mammograms and vaccinations, things like there's a welcome to Medicare physical at the beginning when you first come to Medicare, and then each year afterwards is just a follow-up to that. And as you said about the tracking, what the point of that is to get a baseline of health so that doc and you can work together to, do the best you can to either cure that if possible or live with it.
Or first identify it.
Yes, indeed.
Yes.
Indeed, identify it. Absolutely. But just really nice, and it's a long list of preventative services. So I'm not going to go through all of them, but there's a good long list that you should absolutely, as a Medicare beneficiary, take advantage of.
Yes, exactly. I mean, they're covered. I mean, you've been paying for this for 10 years, your 40 year
work
quarters.
Credits, yep.
And this book has it all in there. It explains it to you. Maybe your kids can help you with it, or you can talk to a SHIP counselor, which is on the screen. Well, now, Kimmy, there are some helping programs that are out there for certain individuals if they're eligible. Can you tell us what those programs are and how they help the Medicare beneficiary?
Sure. I think it's really, really important to clarify that this is a hand up, not a handout.
Right.
It's very important to remember that as we age, our salaries and the pay that we're getting may not rise with the cost of living, and certainly may not rise with the cost of ever expanding sort of medical costs.
Right.
So this is really a hand up, and for some folks it's going to be important. Of course, it's based on your income and your assets. Again, you can talk to a SHIP counselor about this and find out if there's anything you might be eligible for.
And each of the programs are different eligibilities.
Yes,
so
indeed.
If you're not eligible for one, doesn't mean you're not eligible for all.
Exactly. And let's just talk a minute about which programs we're referring to. One is called MSP, or Medicare Savings Program. And that program helps pay your Medicare Part B, so that outpatient coverage, helps pay for the out-of-pocket, the monthly cost of that or whatever. If you get, and there are also several levels of MSP, so you may be a little bit
eligible.
Yeah, or a lot eligible.
Yeah.
So again, as you said, just because you're not eligible for one thing doesn't mean you won't be eligible for others. Then we also have LIS, or Low Income Subsidy. And the Low Income Subsidy is specific to the Part D plans, or the prescription drug plans. And it helps, again, pay those out-of-pocket expenses that might really add up as you are going along.
Yes.
And then we also have Big Sky RX. And Big Sky RX, I just love this program. We call it a homegrown program because it's a Montana program.
Yes.
And it helps pay for the premiums for Part D. And that's it. It only the premiums, and only up to a certain amount.
Part D prescription.
Exactly. And also, this is another one of those programs that you might be eligible for this when you've never been eligible for any other thing, because it's a little more generous in that regard. So we have that. And then finally we have Medicaid. And Medicaid is really for folks who have the very least amount of income and assets that really need the assistance. And so what will happen is you're called a dual beneficiary, which means you're on Medicare and Medicaid. Again, that's not for everyone. It's not everyone will be eligible, but you can talk to a SHIP counselor about those eligibility criteria and see if you might fit one of them or maybe all of them. Who knows?
Yeah.
But it's worth a try.
And it can change every year based on your income level, your health, your bills, what your needs are. So maybe you've applied once, I'm not eligible. That doesn't mean you aren't eligible forever.
Right. That's exactly right. And the helping programs, the great thing about the helping programs is that there really isn't a deadline. You can really choose to look into those at any time throughout a year that it seems like you might be eligible and might need that.
So these programs are wonderful.
Yep.
We're drawn to a close on the show, so Kimmy, I'd like to thank you for joining us.
Sure.
And if I could kind of recap for our viewers, we've been talking about Medicare, how you become eligible for that at age 65, maybe earlier if you have certain disabilities. But if you're working beyond 65 and you're covered with insurance at work, talk to your SHIP counselor, talk to your HR, make sure you have a better plan at work, and let Medicare know that you're going with your work insurance. But we also have helping programs to help individuals that maybe just don't meet some of the criteria of other programs. The SHIP counselors know the eligibility for all of those, and I'll say they work for the Office on Aging, the agency programs. They know other programs that you might be eligible for, Meals on Wheels, guardianships, all kinds of legal stuff too. So call your SHIP counselor, and we'll see you again shortly. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.